Now the next thing that we will be studying is about the autoimmune disorders. Is about the autoimmune disorder. What is autoimmune? Auto means self and immune means our immune system, right? Immune system. So what happens in the immune disorders is that the body immune system fails to distinguish between the self and the non-self. Okay. Just like if somebody comes to your house and you are not able to recognize that person, and maybe he is an enemy to you, right? And you let that person inside your house. So your body is not able to differentiate between what is self and what is non-self. Okay. Similarly, what is autoantigen? Autoantigen means body's own protein mistakenly targeted. Okay. And what are autoantibodies? They are the antibodies which are formed against the self-antigen, right? So these are the basic terminologies which you need to understand when we are discussing about the autoimmune disorders, right? Okay. Then you have the pathogenesis, basically the mechanism. First one is there is loss of self-tolerance. What happens? You have two types of tolerance, central one and the peripheral one. Central one and the peripheral one. In the central one, what happens? There is failure in the thymus or the bone marrow, that is T cell or the B cell, right? In the peripheral, there is failure in the energy suppression or the process of apoptosis. Now, what are the triggers you have? You have certain triggers. First one is the genetic predisposition, like the HLA association. Example is HLA-DR3. Okay. Then you have the infections like the molecular mimicry. Example is the streptococcal infection. Then you have certain drugs. Then you have certain hormones. Hormones, they are more common in the females, like that influences the estrogen. Like there is a more influence of estrogen in females as compared to the males. Okay. Now, let's see the mechanism. In mechanism, what happens is you have molecular mimicry, epitope spreading, exposure to hidden antigens, and defective immune regulation. Now, what happens in the molecular mimicry? You have a foreign antigen which resembles the self-antigen. Basically, like this is your self-antigen, right? This is your self-antigen. And you have a similar looking antigen which resembles to your self-antigen, right? This foreign antigen also resembles to the self-antigen. Have I made this clear, right? Then you have the epitope spreading. What happens in the epitope spreading? You have an immune response which expands to other self-antigens. Basically, when there are other self-antigens that are there, so your immune system basically responds to them. Okay. Next that you have is the exposure to hidden antigens. Okay. All the things which are hidden inside and we are not able to see them superficially. We have to go deep inside, right? So they are basically injury release previously sequestrated antigens. Okay. Then you have the defective immune regulations. They are regulated by the T cells, okay, when the T cells are impaired. Next, this was all about the mechanism and the pathogenesis. Now, let's see certain diseases which you have. And one more thing, if this question comes now that you have to write a short note on autoimmune disorders, first you have to write the definition, then the pathogenesis, mechanism, and then write this table. Okay, this table is very, very important from your exam point of perspective. I am giving it 2 stars. Okay, so you have disease. Here I have written the diseases, the features, what are the specific feature that this disease has, and the autoantibodies. So first you have the SLE, and it is a multi-system is involved, multi-system disease, and it has autoantibodies like ANA and anti-dsDNA. Then you have the rheumatoid arthritis. It has symmetrical arthritis. Autoantibodies are the rheumatic factor and the anti-CCP. Then you have the Sjogren syndrome. You have a very, very characteristic feature in Sjogren syndrome, that is your dry eyes and dry mouth. And the antibodies are anti-RO and SSA. In scleroderma, you have the skin fibrosis and the Raynaud's phenomena, right? Remember this term of Raynaud's phenomenon, right? Next, let's see them in detail. First one you have is the systemic lupus erythematosus, that is your SLE, and you have a very classical image. See, this is a very classical image of a butterfly rash or the malar rash. Okay, and you know what? One characteristic feature is that you are able to see that this rash basically spared this nasolabial fold. So they spare the nasolabial fold. Okay, they basically spare this nasolabial fold. Next thing that you need to see is about what are the symptoms it has. It has a malar rash, there are photosensitivity is there, oral ulcers are present, arthritis, nephritis, and they are basically a multiple system involving disease. Okay, so if you are not able to remember the clinical features in your exam, just remember that it is a multiple system involving disease, right? Just remember one or two diseases which are common to that particular system, right? Like if you have a joint involvement, arthritis is very common. If you have a kidney involvement, nephritis is very common. So just think accordingly in your exams, right? The investigations that you need to see is, it is ANA will be sensitive, Anti-dsDNA will be specific, and you have the proteinuria which will be there. Then what are the complications? In the complications, you have the lupus nephritis, strokes will be there, pericarditis will be there. What is the treatment we can give? You can give the steroids and the hydroxychloroquine, and you need to study this from your pharmacology perspective as well. Okay. Next, let's see our favorite topic of diabetes. That is your type 1 diabetes mellitus. Okay. Type 1 diabetes mellitus, what happens is that T cell mediated destruction is there of the pancreatic islets, and the autoantibodies is 𝗲𝗵. It is mainly present in children and the young adults. We all know this. What are the features? You have polyuria, increase in the frequency of micturition, polydipsia, increase in the hunger, and there is weight loss also which is there. Okay, polyuria, polyphagia, polydipsia, they are basically the classical features that are seen in the patient of diabetes. Okay, then you have complication. What are the complications you can see? You can see the ketoacidosis, retinopathy, neuropathy, and what are the complications it have? Nephropathy, right? So there are many complications which diabetes have, and it is very important to treat diabetes and diagnose diabetes at a very early age, so that if a person is able to modify, if a person is able to keep a active life, right, not a sedentary life, an active life, then he or she will be able to recover from that at a very early stage, right? So it's very much advised that you should always live an active life. What are the treatment? Lifelong you have to be in a insulin therapy. And you know guys, not a human case which I have seen, but I have seen a live case of an animal who was a diabetic. My pet was diabetic. So he had a sugar level of 660, and regularly we used to give him insulin. It's so much painful, right? So that's why it's very much advisable to keep your lifestyle very active and not eat much. Okay. Next you have is the Hashimoto thyroiditis. In Hashimoto thyroiditis, what happens is the autoimmune attack on the thyroid. Your immunity attacks on your thyroid gland. What are the autoantibodies you have? You have the anti-TPO and anti-thyroglobulin. Symptoms what we are able to see? We are able to see there is weight gain, cold intolerance, fatigue, and goiter. And see, this is basically a very beautiful diagram which you are able to see. What are the things you are able to see? This one, you are able to appreciate the thyroid follicles. Next you are able to appreciate this blue one. They are nothing but your lymphoid with prominent germinal center. Then you have a dense mononuclear cells. Which are able to appreciate. So this is a very important diagram, And if you are able to draw this beautiful diagram in your exams, you will get full mark in that questions, not in your entire question, not in your entire paper, right? In that question, you will be able to score good. The investigations that you are able to do is there in the investigation, you are able to see that there is raised level of thyroid stimulating hormone and there is low level of T4. Okay. The treatment which you will give is the levothyroxine. Treatment you will read more in your pharmacology, right? Next you have is the Graves' disease. So Graves' disease, what happens is the autoantibodies stimulate the TSH, thyroid stimulating hormone receptor, as a result of which there is hyperthyroidism. As a result of which there is hyperthyroidism. And guys, see, this is a very classical image of Graves' disease. The eyeball of that person protrudes out, right? It's not that he or she is seeing you in that anger, but it's Graves' disease, right? So next time, whenever someone stares at you in anger, just make sure that you are able to do the thyroid profile of that person, okay? Next symptoms that you have is the weight loss, heat intolerance, then you have tremors, right? The flapping tremors that you have. Then you have the 𝗲𝗵𝗵𝗺, okay? This is basically 𝗲𝗵𝗵𝗺. Next, the investigation. In the investigation, we are able to see the TSH levels are low. There is high level of T3 and T4 and there is positive thyroid stimulating hormone receptor. What is the treatment? Obviously, this is thyroid, so we will give the anti-thyroid drugs and you will tell me what are the anti-thyroid drugs that you will give, right? Then you will read that in your pharmacology lectures, okay? Next disease that you have is that of rheumatoid arthritis, and this is also very common in young people, right? Or the middle-aged people. There it is very common. The pathogenesis you have is the autoimmune inflammation of the synovial joint. So you have the inflammation of your synovial joint and you have certain deformities in your rheumatoid arthritis. You know what are the deformities? You have a swan neck deformity, like this will be the finger of that person who is having rheumatoid arthritis, okay? Then you have the pannus formation and the cartilage destruction. It is 𝗲𝗲𝗃4. So you can remember it with a mnemonic which is very famous. 𝗲𝗲𝗃4. Okay. So remember the 4 rheum wall. Okay. Remember the 4 rheum wall. Okay. Or remember the wall has 4 rheums. Okay. You can remember this. So it is 𝗲𝗲𝗃4. Next you have is it has the rheumatoid factor and the anti-CCP antibodies. What are the clinical features you are able to see? You are able to see a morning stiffness. Okay, whenever a person wakes up, that person is able to appreciate that there is so much of stiffness in the joints that are present. Okay, joint deformities, you have the ulnar deviation and the swan neck deformity. Okay, next investigation, what you will do? See, my fingers are very much flexible. I'm not having rheumatoid arthritis. I'm just showing you that how it looks. Okay, so investigations, you have the rheumatoid factors which is positive and you have the anti-CCP antibodies which are high and you have an elevated level of ESR and CRP, that is your C-reactive protein. And when there is an increased level of C-reactive proteins, what I have told you, you need to suspect that the person is having any sort of infection that is going inside his or her body. Okay. Next, what is the treatment you will give? You will give the NSAIDs. Okay, for the pain relief, and you will give the DMARDs like methotrexate. Biologics, what you will give? You will give the TNF inhibitors and rituximab and corticosteroids during the acute flare-ups. Right? Have I made this clear? I think so. Okay. Next that you have is the systemic sclerosis. So in systemic sclerosis, what happens is there is excessive collagen deposition. There is excessive collagen deposition which is there, and there is fibrosis of skin and organs, as a result of which there is vascular injury and the immune activation. Clinical features, what you are able to see? Skin thickening will be there. Raynaud's phenomena. Oh my god, it's so important. Whenever someone asks you about this Raynaud's phenomena, just remember systemic sclerosis. Okay. Next you have is the gastrointestinal motility and the pulmonary fibrosis and the renal crisis. Investigations. In the investigations, you will see anti-SLE, anti-centromere antibodies, nail fold capillary changes will be there, and in the HRCT of the chest, you are able to see fibrosis. And you will learn this about this chest X-ray interpretations in your radiology class. Okay. The treatment which you will give, there is no cure. Sad. The only systemic management you can give, the vasodilators like the calcium channel blockers. Do you know any calcium channel blockers? Like nifedipine, right? Then you have the immunosuppressants and the proton pump inhibitors. Proton pump inhibitors, very common. Which one? Omeprazole, right? Next, what are the clinical features you have? Fatigue, fever, weight loss, joint pain, skin rashes, and organ-specific dysfunction, right? See, just whenever you are preparing for exam now, just make a common list of all the clinical features that you have, because there are certain clinical features which are there in each and every disease. Like fatigue will be there in each and every disease, weight loss will be there, joint pain will be there, fever will be there. If the person is having fever, he or she will surely have the joint pain. So just make sure that you make certain clinical features which you will be able to write in your exams, right? Investigations, what you will do? First is the CBC you will do. In the CBC, you are able to see the either the person is having anemia or the leukopenia. In the ESR or CRP, you are able to see the inflammation markers. Obviously, they are the inflammation marker and it indicates that there is certain infection that is going on in the body. Then you have the autoantibody test, which is very disease specific. Now, I have also made a table for you all. I have done all the hard work for you all, so you don't have to, do all these things. Just go through this table. 1 or 2 MCQ will come in your university exam from this table. If it is ANA positive, it is positive in SLE. Anti-dsDNA, SLE specific. Rheumatoid factor, the name suggests rheumatoid arthritis. Anti-CCP, rheumatoid arthritis. Anti-TPO, TPO, Hashimoto, TT, okay? It has T and D, Hashimoto. Anti-acetylcholine receptor, myasthenia gravis. And anti-SSA, you have the Sjögren's syndrome, okay? Imaging in journal, what you will do? You will do the X-ray, which shows you the what are the joint changes that are involved in that disease. MRI will show the CNS involvement, if there is any sort of CNS involvement is there in the disease or not. Ultrasound, which is for the organ assessment. Okay. Then you are able to do the biopsy. Biopsy is for the confirmation of tissue inflammation or fibrosis. Treatment, in the treatment, what you will give? See, this is basically the general treatment which we are talking about. First one you will give is the immunosuppression. In the immunosuppression, what you will give? Corticosteroids, DMARD, biologics. In biologics, you will give the rituximab. Cytotoxic drug. In that, you will give the 𝗖𝗵𝗵𝗿. Okay. Symptomatic treatment. NSAIDs are basically for the pain and inflammation. Then you can give the hormone replacement and the anticoagulants. Third, you have the supportive therapy. In the supportive therapy, what you will give? You will give the physiotherapy, nutritional support, and the counseling to the patient. You have to tell him or her that everything will be fine at the end. Okay. Like, it's a dialogue in some pictures, right? That in the end, everything is fine. And if it is not fine, then it is not the end. The picture is still whatever. I don't remember the dialogue. Just see that picture, okay? I guess it's Om Shanti Om. I don't remember. Okay. So the fourth one is avoid the triggers. What are the triggers that you have? You have the UV protection and the infection control that should be there. What are the complications you can have? First one is the organ failure. Organ failure can be there. Renal, hepatic, and the cardiac. See, these are also the most common organs which are involved. So they are basically getting damaged. Can have osteoporosis, which is very much common in females. Then you can have infections that is due to the immunosuppression. If the immune system of that person is suppressed, then he or she is more prone to having an infection, right? Then you can have the thromboembolic events and there is a risk of malignancy. See, this was all about the chapter, and now you have a summary table which I have made, that autoimmune disease results from the self-tolerance. Diagnosis relies on the clinical features that we have seen, and immunosuppressive therapy are the mainstay of treatment. So you need to remember this much in the autoimmune disease, right? This is a very important chapter. Let's solve some questions. First one you have, what is the first one? Which of the following antibody is most specific to SLE? Okay, they are asking about the SLE. So which is more specific? Is it the rheumatoid factor? Rheumatoid factor is not, it is specific to rheumatoid arthritis. Antithyroid, specific to Hashimoto. Anticentromere, it is specific to what? You have to tell me. So the remaining option is, it is anti-dsDNA antibody. Okay. Next question. Next question that you have, there is a 28-year-old female which presents with symmetrical joint pain and morning stiffness. Oh my god, they have given a very important clue in the question, morning stiffness. And we have seen just now that morning stiffness is seen in which of the following disease? It is seen in the rheumatoid arthritis, right? And it is also saying that it is anti-CCP antibodies which are present. See, morning stiffness, now I can give you two diagnoses. If the person is saying he or she is having morning stiffness, so there can be two differential diagnoses that we can make. First one is the rheumatoid arthritis, and the second one is the ankylosing spondylitis. Okay, ankylosing spondylitis. But in this, you are able to see a very specific characteristic, that is the bamboo spine. You are able to see bamboo spine. Okay. So you have to see the second statement which I have given. They have given that it is anti-CCP antibodies which are there and it is present in your rheumatoid arthritis. So this was all about the autoimmune disorders, right?